Blood Reprogramming Technologies. Skin cells to treat cancer, be the match.
Good afternoon, everyone. We are Blood Reprogramming Technologies, and we are here to introduce MiStem. So imagine that you are diagnosed with a multiple myeloma, a leukemia, or a lymphoma, or other blood disorder that affect the formation of blood. Unfortunately, you wouldn't be alone, because actually 3.5 million of patients are diagnosed with these problems each year. And so what this means is that these patients will need a bone marrow transplantation, which actually means that is a transplant of blood stem cells. So in the beginning, after diagnosis, you would be submitted to chemotherapy or radiotherapy to kill the cancer cells, and then eventually you will need a transplant in order to regenerate your bone marrow and your blood system. And regarding the transplant, it can be in two different ways. So you can have an autologous transplant, and this means that you get your own blood stem cells. But here, there's some problems related with this. So for some patients, the cells are unhealthy, so they are not ideal for the transplantation. And for other patients, we cannot get enough cells in sufficient number to perform the transplant. Other alternative is to have an allergenic transplant. And this means that you'll get the cells from a donor. But here we have the compatibility issues, and they lead to severe medical problems as graft versus host disease and graft failure. And this is actually responsible for 25% of the 3-year mortality associated with transplants. And so for all these reasons that I've explained and other more, this represents that the 3.5 million patients that need a transplant, which actually correlates with 500,000 that lives in high-income countries where they can actually pay for this treatment. Only actually 60,000 transplants are attempted each year due to all these limitations that exist in this problem. And so in summary, we can have autologous cells that are compatible but are not healthy, or we can have allogenic cells that are healthy but we lose on the compatibility. Another alternative would be to use umbilical cord cells, but here the cells are not in sufficient number, and this is limiting. So over more than 30 years now, researchers are trying to find the perfect spot, so cells that are healthy, compatible, and in sufficient number. And once you can achieve this, we can actually treat more patients with less risk to the patient. And actually, we hit the spot. So with our technology, it is based on a cellular reprogramming concept. And this means that we can change the identity of a cell. So we can take a skin cell and convert it into a blood stem cell. The way we do this is because we have identified these 3 key transcription factors. So these are proteins that go inside the cell and change their identity. And now we have a blood stem cell. So these results were really exciting for the scientific community, and they were published on this top journal on the field, Cell Stem Cell. And importantly, we have done this using human cells. So we have converted human skin cells into human blood stem cells, and we have confirmed that these cells actually comply to the 3 key criteria for blood stem cells that are morphology, gene and protein expression, and functionality. And so this means that we can take our human cells and we inject it into mice, and after 12 weeks we can detect human cells in the blood of the mice. And this is quite fantastic, right? And so we have completed the proof of concept with human cells. And so our product, since they are personalized blood stem cells and they are multipotent and inducible, we have called it MiStem. And so the way this would work is that the doctor will perform an easy skin biopsy to collect the skin cells. The cells will be shipped into a central laboratory where we do the reprogramming process that takes 6 weeks. And then we ship the cells back into the doctor that will transplant the cells into the patient in order to regenerate the blood system. And so our MiStem products, they are healthy, compatible, and in sufficient number of cells. And so regarding the market, as I already mentioned, there's 500,000 of new patients diagnosed with these disorders in high-income countries, and we have set our price at 70,000 euros, and this includes our estimated production costs, and up to 40% of gross margin. And this gives you a 35 billion market. But as this is a therapy product, we actually need to choose the entry market to perform the clinical trials. And we have chosen multiple myeloma. And why? Because there's a high medical need for this disease. It's actually the most common indication for transplant, and there's a high mortality associated with this disease. And only for multiple myeloma alone, the market is now 4.3 billion, and it is increasing. And importantly, this is an orphan disease. And this means that a relatively few number of people are affected, and we have a regulatory advantage with this because we can shorten the clinical trial period and shorten the costs to do it. And this justifies our roadmap. So we have, on the past 6 years, performed R&D and the proof of concept, as I mentioned. Now we have to optimize the process and translate it into a GMP process to produce the cells. We are licensing the patent that we already have and planning to file a new patent to protect the product. And after regulatory approval, we can do the clinical trials that we anticipate will take around 7 years. And then after regulatory approval, we can start selling and entering the market. And this means that after 10 years, after getting the market with our projected financials, we'll get a free cash flow around 3 billion into 2036. So our team, it is composed of 3 researchers, Philippe, myself, Cristiana, and Fabio, and we have a combined 22 years of research experience in the cellular reprogramming field. And we also have the collaboration of 2 amazing MBA students, Rui and Max, and we are really excited to take this project into the next level. So I would just like to wrap up saying that Ian Bernstein, which is a key researcher in the cancer malignancy field, once said that making a blood stem cell in vitro is the holy grail of regenerative medicine. And it looks like we have achieved this goal. And with MiStem, we can treat more people with less risk to the patients. Thank you very much.